This morning, cases of COVID-19 are on the rise in all 50 states for the first time since January. Unvaccinated Americans account for most of the increases nationwide, but so-called breakthrough cases among vaccinated people are increasingly common as the Delta variant spreads. There's also confusion about booster shots and whether fully vaccinated Americans should get a third shot. This comes after some conflicting reporting from Pfizer and the CDC over if and when Americans might need another dose. CBS News medical contributor Dr. David Agus joins us. David, good morning. Why these conflicting messages about booster shots?
Well, I think, there's no question that Pfizer did the right thing, which was submitting the booster for FDA approval, because it'll take time to do that, and it will be ready when we need it. There's a population in the United States that will require a booster, but at the present time, no one requires a booster. And we can know that by looking at the hospitalization rate across the country of people who have been vaccinated, and it is remarkably low. They're not getting serious infection.
All right. What do we know at this point, David, about how long immunity lasts?
So what we know is there's some antibody studies showing that at about 6 months, antibodies start to fall. But antibodies are a tiny piece of the puzzle. The T cells are the key part in making the vaccine give you immunity to protect you from the virus. So my gut is we're going to see the elderly, people with medical conditions, toward the end of the year, beginning of next year, will need boosters. In Israel, they started to give boosters to people who were immune suppressed, on chemotherapy, HIV, autoimmune diseases, and only them. And so people with immune issues earlier, elderly next, and we'll see after that.
Dr. Agus, it's Vlad. We've been seeing more of these breakthrough cases. I know a lot of them are anecdotal, but people who've been vaccinated getting sick with COVID-19 and, in some cases, pretty sick. Not enough to go to the hospital, but still sick enough to be at home. What do you make of that, and how concerned should we be?
Hi, Vlad. There's no question these vaccines work. They are protecting most people on exposure from getting symptomatic from COVID-19. But there's a significant portion that gets mild symptoms, some of them more serious, but most, very few actually get hospitalized. So what happens, right? This Delta variant is remarkably infectious, and it makes you much sicker than the other variants we think now. And so because of that, we're really saying is that our behavior has to change. What you could have done and not gotten the virus with the last variant is not true with Delta variant. This is a new virus that is behaving remarkably different.
So let's talk about where you are, David, in Los Angeles. Los Angeles County now says you have to wear a mask whether you're vaccinated or not. And some people say that's sending a conflicting message, because for those of us who have been vaccinated, and that's all of us at this table certainly, you'd like to think that you're protected. That's why you get a vaccine, so you're protected against the people that are not. So why do we now have to wear a mask? It's causing people are very confused.
No question about it. I mean, public places, you have to wear masks in LA as of Saturday night. Part of it, I think, is that, politicians don't want to say the aggressive thing is saying we are going to check vaccines before you walk in, like they did at the Springsteen concert on Broadway. And, by not knowing who's vaccinated or not, we see what's happening. It's going up in every state in the country because the behavior is not appropriate, right? People who are not vaccinated should be wearing a mask whenever they go out, and they're not. And so the only way around it now in LA, short of showing vaccine IDs or immunity passports, which they're not going to do, is by saying everyone has to wear one. And I know it is frustrating and confusing.
The honor system ain't working. It's just not working.
Yeah. Nope. The other question I have,
no,
David,
and it should.
Yeah, but it doesn't.
Yeah, it doesn't. David, I have a question about, as the country starts to reopen and more people are making plans to return to the office in September, do you envision a world where that doesn't happen, where we roll those options back in September?
Well, my gut is that what's happening now is we're going to see a significant increase in Delta variant across the country. And with this new wave, I do think it will be one of the last in the short run. And so my hope is they will be over by the end of August and September, and we can go back to schools and workplaces like everyone planned for. What it really requires is us to continue vaccinating and really to follow the mandates of behavior. And, we're not doing it right now. And I don't understand it, is that you look around the world every country is begging for vaccines. We have more vaccines, than we have people, and yet we're not using them. It really doesn't make sense.
Excellent point. Dr. Agus, thank you as always, my friend. Appreciate it.